Jamesha Ford, and I'm the founder of Generational Health. This organization was kind of formed out of grief. I did have more than a few deaths in my family last year, and many of the deaths were what some of us would deem preventable. And so I decided to bring together a bunch of colleagues of mine who are on this call and a part of the organization to raise awareness of certain or many conditions that affect our community more so than our counterparts. And so in doing so this month, we decided to talk about COVID. COVID is not foreign or new to anybody. And I'm sure everybody has been affected by this pandemic. So we wanted to talk about COVID itself, and then also the COVID vaccine and the hesitancy with the vaccine, and also answer any questions and participate in any discussion topics that you guys may have. So I wanted to throw that out there because this will mainly operate as a dialogue, and I'm open to it being an open discussion with you all as well. So the two speakers I have on the call with me is Tiandra Finch, which I'll have her introduce herself, and Student Doctor Shenika Zarebski. So I'll let them talk about themselves and let them tell you guys who they are and what they're about, and then we'll go from there. Tiandra.
Hi, everyone. Like Dr. Ford said, my name is Tiandra Finch. I'm a certified and licensed athletic trainer, which is an allied health profession. I now fit in a space as a patient advocate. So I have a lot of the knowledge, but only enough to be dangerous, right? I have enough knowledge to ask really good questions and to make sure that as patients, we are choosing what we do with our bodies and decisions that we make involving our health and our wellness, and also making sure that we advocate for ourselves and for our loved ones. So I am the founder of Spirit Over Flesh LLC. It is a health and wellness entity and really focus on health literacy, making it plain what medical jargon is used on a day-to-day, making it very, the laughter is great. If you can, please mute your mic so that way we can be intentional when you join into the conversation. And what else do I want to say? I said most of it, but thanks for the laughter. Shenika.
There's something very sweet about that. So thank you. My name is Shenika Zarebski. I am a second-year medical student at Ohio University. I've been a healthcare provider as a certified nurse midwife for the past, since 2009, so 12 years. I served as an active duty military member in the Air Force as a advanced practice provider. And now I am changing roles and hoping to become a surgeon that serves communities that are often overlooked. So I had the pleasure of being introduced to Dr. Ford and Tiandra through Generational Health, and having an opportunity to share some of the research that I'm doing as a student in terms of vaccine hesitancy within the community. So the hopes today would be guiding, going through kind of some of the research I did, but stopping as we discuss this research to talk about your thoughts and how this applies real time to our community. Is it okay if I share my screen now?
So we're going to start the discussion with Shenika sharing some of, or Student Dr. Zarebski sharing some of her research with vaccination hesitancy as she spoke on within our community. And then if you guys have any questions or anything, feel free to throw it in the chat. I think there's a raise your hand feature just so that we're not over talking. But if that question is throughout this presentation, definitely feel free to ask it and we can address it or we can discuss it. Okay.
And are you guys seeing the presentation mode of that? Great. Okay, So thank you again for allowing me to have the floor on this. Yesterday, I was honored to present this at the American Public, the American Public Health Association annual meeting. And my research is entitled Investigating the Impact of Medical Mistrust Within the Black Community and COVID-19 Vaccine Hesitancy. Sorry, I'm adjusting my view here. So COVID-19 is a pandemic that's been devastating the world for far longer than any of us ever imagined would be the case. Since 2020, there have been 237 million reported cases worldwide. More specifically, in the United States, we've had 44 million cases reported with 709,000 deaths as of October of this year. So one would think that with this high rate of mortality, a vaccine would have been kind of warmly received globally. So this is actually a report posted by the CDC stating that only 11% of African Americans, or those that self-reported as African American, have had at least one dose of the vaccine. As health care providers and public health officials work to combat the virus, it's apparent that there's a sense of unease amongst some community members, and that there's a slow to vaccinate rate. So the true resolution to this emergency is to investigate the rationale circulating across many media outlets and whether or not we think.
Are you trying to advance through slides?
Oh, can you not see my slides
We
advancing?
only see the first slide.
Okay, thank you for that. One sec. Can you see it now?
Now we see it.
Okay, I was only advancing on my slides. Okay, one moment. So again, the CDC is reporting that approximately 11% of US Americans that self-identify as Black have had one dose of the vaccine. And one of the aspects of the literature, of the research that I found vital to address is why? Why is it that we see that there's this hesitancy amongst our community when the media keeps constantly pushing back that it's historical medical mistrust? So I'd like to pause right here and just talk about that and see what that looks like for everyone in the audience.
Yeah, I mean, we can start throwing some examples out there of what we hear often as referred to as medical mistrust. So the first thing that comes to mind, not for me, this is not my answer, but the thing that is thrown around a lot is Tuskegee. So that's a commonly used example of medical mistrust, especially for the Black and even African-American community. Tuskegee, you think about sterilization, taking away our population's right to populate, to have children. And personally, I think that the infant mortality rate for Black women throughout the globe, as well as current occurrences of iatrogenic events, which are things that occur to people within the medical system that causes illness or injury. So for example, you're going to have your ACL reconstructed, or you got in a car accident and your tibia is fractured, and they have to go in and they set it with a medical screw. And upon surgery, something else gets left behind in your leg, like a glove or a piece of gauze, and it causes an infection, and then you get sick and you have to get your leg amputated. That is an example of an iatrogenic event. And it's some of those medical mistrust issues that occurred historically, but are still occurring today. Are there any other examples of medical mistrust you can think of, Dr. Ford?
I think you hit on like the pretty big ones, the popular ones, but you know that there is a huge number of other experiments that have not made, I guess, the media. Just thinking back in history, and actually, there's a book out there called Medical Apartheid that kind of goes through a bunch of those experiences that have happened and continue to happen.
Those are excellent points. There was actually an NPR article that came out and addressed whether or not people were not getting the vaccine because of Tuskegee. And an interesting point that was brought out is that it's not so much the historical mistrust, it's the current day atrocities that keep happening with lack of access, lack of having a consistent provider in that community. It's essentially the conversation is, why do you care about me now? And I think that's a very valid question to say. I've been asking for diabetes help. I've been asking for better hours to get into the clinic. I've been asking for this. And now suddenly this is what's important to you. So essentially what I did was my study is attempting to reach this why, the true why of this hesitancy. And so I conducted a survey. It was a snowball sampling survey, yada, yada, yada. Basically, what I did was I posted a survey on my personal Twitter, Facebook, and Instagram. And it was completely anonymous. It was a free to share. It was the link could be shared amongst individuals that participated. It was open for 15 days. We had 205 respondents. So we were kind of blown away by just the number of respondents in that short amount of time. But it was a 33 item survey that included Likert scales, open-ended questions, utilizing Qualtrics. But it had, the questions were adapted from a medical mistrust index, as well as a coronavirus health impact survey. And we were really surprised at a lot of the results that we got. So in the interest of time, I can only share a few of the findings. As Dr. Ford may have already seen, like the 78 pages of data that we are still combing through right now. But I'd like to address, and I'll pose another question when I address our population that we sampled. And then I can touch on the reported hesitancy and lastly, looking at timing of consideration for vaccine acceptance. Essentially, I'd like to put out the fact that maybe instead of having this conversation of that the Black community is refusing the vaccine, is that painting it in a different, changing the narrative and talking about the hesitancy. So our population was very unique. Of our respondents, 44% self-identified as Black, 46% the respondents identified as white, and we have representation from Alaskan Natives, Asians, and those identifying with more than one race. So sorry, I lost connectivity for a second. So our study, 49, again, 40, about half of our respondents were Black and had a graduate or professional degree. If you look according to the 2019 Census Bureau report, of those that self-identified as Black, not necessarily African-American, but as Black, there were only 0.7% respondents had a professional degree and 1.1% had doctoral degrees. That's in the entire United States, which is interesting that that's what's being reported, but that's coming straight from the 2019 census report. 57% reported a household income of over 75,000, 77% over 50,000, while the average household income in Black homes were again reported through the Census Bureau was $45,438. So we're looking at a highly educated group of individuals with resources. And I'd like to pause right here and just and talk about that, because I feel like some of the solutions that are being thrown out, or some of the incentives being thrown out, are troublesome, in saying that putting it into a lottery system, or I'll give you $500 to get a vaccine. I could see where that would make people pause. What are your thoughts, ladies?
Yeah, for sure. I think what you're addressing is the fact that Black people, we're not a monolith. And oftentimes the media, and even reflections of ourselves in the media, so Black professionals on different outlets discussing the vaccine, like you said earlier, are talking about refusal and not hesitancy. So once they've made the assumption that all Black people who are not currently vaccinated are refusing or not just hesitating, they also then make an additional assumption that I can bribe you or incentivize you into choosing to do something different than what your initial choice is for your body. And that's problematic in itself, because now you're not open to having the conversation to support me in making an informed decision for myself and my family. But you're trying to persuade me into doing it. And when we talk about healthcare, right, and medical mistrust, to me, that only adds to that narrative of me not wanting to trust an entity who's supposed to care about my well-being and are taking measures to simply bribe me. I think that speaks highly, like, for the direction in which they're going and what they assume the Black population to be.
Absolutely. I wholeheartedly agree. I also think that it also touches on another aspect. Where did they find all this money to throw out to these to incentivize people? Why are we not investing that in preventive healthcare? And it's another aspect where it's like, okay, let's throw all this money at a cure for diabetes, or we could make affordable, healthy foods and lifestyle changes that allow people to exercise, safe places to walk, green spaces where there's none before. But we're going to it's an insult to say, okay, here's a lottery, they'll go and jump at this, but I'm not going to invest this money into the schools, into the communities, into this to address this preventative health. So hopefully you can appreciate that the population that we're sampled is unique. It's quite possibly a group that's often not portrayed in the media, but we still see hesitancy. So the narrative that it's a lack of education in the Black community that's preventing them from getting the vaccine, or as another barrier, is kind of moot in this population. Yet we still see hesitancy. If you look at the chart in front of you, 62.2% of Black respondents stated that they would get the vaccine if it was offered to them that day, and 23% said no. They said they would not get that day if it was offered. This is a difference from their white counterparts of a 5.7% declination. But another metric, and this is where we're talking about the hesitancy versus the refusal, is looking at how long it would take for an individual to feel comfortable taking this vaccine. So as a frame of reference, this survey was disseminated in March of 2021. So this was pre FDA approval, pre-conversations of mandates. And I think that's another very important, we'll put a pin in that for conversation's sake. But these results truly speak toward the argument that hesitation doesn't necessarily mean refusal. Because if you look at the chart, only 20% of Black respondents said that they are not interested in taking the vaccine at all. You see, there's those that are interested in taking it less than 6 months, 6 months to a year, 1 to 2 years, 2 or more years, maybe, just to see what is this actually doing to people's bodies. And so that we had 23% that reported no, And then of that 23%, only 20% said that they would never take it. So it's a fourth of a fourth saying that I have no interest in taking the vaccine. So is that refusal or is that hesitancy? And can we change the narrative around that?
We actually had some interaction in the comments, and I just want to lift this up. We asked for any other examples of medical mistrust. And in the comments, it says when someone's pain is dismissed by one doctor, and then later on a serious condition is discovered. And I think that just echoes what Dr. Zarebski, student Dr. Zarebski was saying, that, a lot of times we don't feel heard. So if I'm going to my primary care physician or my hospital system and they can't even hear me when I'm attempting to articulate acute pain or symptoms to help me get to a solution, when it comes to choosing to take a vaccine that for our population, we're thinking is new to people who aren't necessarily in vaccine development. And it's not, let's have a conversation, let's better inform you. Again, it's, we don't hear you. We're just going to continue to talk to the people that can be bribed or incentivized. And so it's almost as if that population is being completely missed and not being addressed at all on a larger scale.
And it's very interesting about certain populations because there is an entire additional group of individuals that are not choosing to be vaccinated as well. So we have a large constituent of individuals that would I self-identify as white, that are stating that they are not going to be vaccinated. And when that's addressed, it's more of a personal choice, more of a freedom of choice, many touting pro-choice buttons. However, it's considered a choice in that community, and it's considered a lack of education, a lack of personal responsibility amongst those in the Black community. So how do we earn the trust of our community? How do we facilitate our community members to make choices that they're comfortable with on their terms? I feel like it's the role of the entire healthcare system to reestablish trust in the Black community. It's not, and it cannot solely fall on the shoulder of those belonging to that community. It's imperative that we find the true barriers to hesitancy, and we must learn the why of this hesitancy. Because we've seen this campaign after campaign, incentives after incentives, but we've yet to determine the why, the actual why. It's like knowing I'm making dinner, it's burnt. How do I fix this? Well, you can't fix your burnt food if you don't know why you burnt it. Like, is your oven too hot? Did you leave it in too long? Is it in the wrong container? You can't figure out the why. I mean, the what if we don't know the why. So I think a solution cannot be found until we understand why the problem is in the first place. Why do we have these barriers? Time could be the solution. Maybe it will be possible after. I'm sorry, it's bedtime in my house, so there's okay, so time could be the solution, and maybe time is what people need, and that's not us trying to address refusal, that's us addressing hesitancy. So maybe after the healthcare system has invested in cultivating culturally fluent providers who can establish trusting relationships in these communities that have gone so far and too long without.
I think with the cultural fluency and even just cultural, respect for any human being. I think a lot of mistrust come with lack of explanation from physicians and how we had this paternalistic approach before, meaning that we just told patients to do things and expected them to do it without questioning it. Because a lot of people can be convinced or whatnot through education and us just explaining what we're doing and what we're giving to them.
And I think
but I don't think that's a cultural thing. I think that's just a respect thing.
Absolutely. And I feel like it's imperative for us to be transparent about our concerns as well. Because when December 20, gosh, what year is it? December 2020, when I'm getting a vaccine that just rolled out, and I'm nervous. Like I'll be very honest. I was like, all right, I'm going to go in, but I'm going to make them mix all of them up and I'm going to pick the one I want. Like this is the narrative of while I'm driving over there. And I'm like, I'm like, I'll take the one that the executive got right before me. You know, like it's just, it was funny and it was a joke, but I was serious. Like I had my concerns. And I think that it takes people to be confident in their knowledge and where their knowledge ends to be able to say, I was nervous because I didn't completely understand this. I have the capability of finding the resources I need to get that. But I empathize with your discomfort. And I respect this diversity of thought in this vaccination and in this pandemic process. Because I don't know what you've seen. You don't know what I've seen. So how do we have this dialogue amongst community members, amongst other healthcare providers that keep people open and keep it a hesitancy versus a refusal?
Right. And that's a bigger conversation. That's not just about COVID vaccine, right? That's the narrative of what Western medicine tends to reflect oftentimes. I think as medical professionals, it is our duty to be honest that medicine nor science is dogma. So just because I say something today does not mean that it's going to hold true tomorrow. And it's okay to be truthful about that and say, even with the information that I know today, I still believe that this is the right decision that I'm making for my body. I can explain to you the reasoning and how I got here. And I can also answer any of your questions to the extent that I'm able. And if there gets to be a question that you ask, I'm not going to belittle you or chastise you because you asked me a question outside of the scope of knowledge that I have available to me, but we can go together to help find that information, or we can be honest and say, you know what, that's a great question. We haven't determined that yet. But those are conversations that are rarely had. Oftentimes when we ask questions and speak up and say, hey, I don't necessarily feel comfortable yet making this decision for my body or for the body of my loved one, it's, well, this isn't what we do here in this office, or you only signed up for a 15-minute consult. So, you know, we have to move on to the next patient. But Dr. Zarebski, in a conversation that we had prior, it is getting back to what primary care physicians were previously, culturally, how we maneuvered, having that opportunity to form relationships with the people that we serve. So that way we can have honest conversation and it's not a dictation and it's getting in and getting out, like an assembly line.
And a peer of mine, we were having this conversation and she'd hit me with one fact and I'd hit her back with another, and it went tit for tat. And she was like, and this is why people aren't listening. And I had to sit down and I was like, oh, thank you. Like, you are absolutely right. Like, I am talking at you, and everything she'd say, I'd be like, well, what about that? And this, and I was like, this isn't a conversation we're having. And it takes people people you trust to be able to tell you, even as a provider, that, hey, like the way you're trying to communicate isn't going to make anybody change. And again, it's nobody wants to feel like they are being forced into a decision. No, and I don't think any provider wants, or any physician or any APP, any nurse, any allied health professional wants to feel like they are coercing people into doing anything. But we want, go ahead.
No, go ahead. I'm sorry.
I mean, we want everyone to, we just want people to be nice and be considerate other people. And I think they want that too. They want there to be heard and their thoughts to be considered. And it takes kindness on both sides and openness and willingness to learn for anything to change.
We have a hand up from Dr. Blood. I'd love to invite you in to ask your question.
Say hi, everyone. Sorry, I have a hiccuping baby in the background, so if I have to stop talking, that's why. But yeah, as a primary care physician, like our system is just certainly broken. It's not effective. I mean, I work for Ohio Health and I love my job, but we only have the 30 minutes with the patient or 15 minutes with the patient. And that's like if they come a few minutes late or if the MA is rooming them, like we just don't even like the system doesn't even allow us to have like honest conversations like what you guys were talking about, like just preventative care. So like we definitely don't have the time. We have the time later to have them come back for an appointment to talk about the COVID vaccine, but we're all busy. Who wants to come back and have that long have a discussion where they're like, well, why can't I just ask you 5 minutes right now? And then, as primary care or as any physician, the patient gets brushed off sometimes, or they feel like they've been brushed off. And then you continue to have that cycle of like, well, my doctor, they gave me this script or whatever. And, we didn't have time to discuss it. They told me to make another appointment. And then there's that continual cycle of mistrust in the system. So we definitely need to do better, around like specialties, primary care, urgent care, all of the different aspects of medicine, so that patients do have that where they do feel like they can trust their providers. But yeah, I think this is, it's going to be an ongoing thing, and I hope that we can continue to make it better for not only our Black patients, but other patients who have been marginalized as well and over history. So, oops, sorry.
Just to piggyback off of Dr. Blood, I too face those same challenges, and that does contribute to this cycle, as you've mentioned. But I think one thing that could remedy that is just transparency. Even we know that we don't have enough time because we're in a time crunch and we only have 15 to 20 minutes allotted for this encounter. But if we verbalize that and reassure the patient that we care and we want to answer their questions, and we want them to come back with those questions, then it doesn't take away the fact that they may have to return, but it may take away them feeling dismissed with that being the case.
I think also starting the conversation with questions is fair, having questions that maybe we had before we took the vaccine, because I've been in classes where I don't even know what I don't know. Like, I don't know what questions to ask. I don't know how, I'm not sure what I should be concerned about. I just know that I'm concerned. And I think that it's important that we have something in our toolbox that starts normal conversations where you're like, well, I see that you're not vaccinated. Are you concerned about this? Do you want to talk about this? Because as a student, we've even been trained in motivational interviewing, that if you've talked to the patient previously about that ad nauseum, that you just bring it up and you move on. You don't probe any deeper on subsequent visits. And it's kind of like, okay, maybe last time they weren't ready to process it, and now this time they are. But as trainees, we're even being taught, okay, just if they say no again, leave it at that. And you're like, or I could be like, hey, maybe you've had time to think about it. Are there any questions this time? And really sit down for a second. And I completely understand about the time situation, because you're like, hey, I'm like, oh my gosh, they probably think I can't do an interview, or I can't do this. I got to hurry up and get out and get these 15,000 questions that I need to ask done. And I can completely understand why patients feel dismissed, or maybe they just don't even know what to ask.
Or don't know if it's a safe space to ask what they have to ask. Because I think even with hosting this conversation and inviting peers of mine who I know fall into the main population of the individuals reflected in your research, right? The households that are bringing in at least $75,000 a year, professional degrees, who still have questions. But because this vaccine has been so politicized, right? And it's nearing the place of criminalization similar to HIV and those kind of topics, it becomes sort of taboo to come into areas with medical professionals and be honest and be forthcoming about what your real concerns are and what you're really thinking. Because a lot of times that's even chastised with, oh, you've been Googling, haven't you? Or I'm the doctor. And when you have those types of responses and you're trying to make the best decision, again, for your well-being, it's hard to know when it's okay to have that open and honest conversation.
I completely agree. Again, that goes back to this a consideration, appreciation for diversity of thought, because there's not a single type of intelligence. So people can be grossly successful and not know how mRNA works. I've been in school for 150,000 years, and I still have to look up how this works time and time again. And I'm okay with that. I'm okay with being transparent to say, oh no, I'm a smart person. I just don't understand how this works. So if you're in a community where often people don't think you're intelligent or don't think that you are capable of doing substantiated research, then why would I come and tell you that I have concerns? So it's fair, and it's not our patients' jobs to navigate this alone.
For sure. I think it's our responsibility to create more spaces such as these founded by Dr. Ford, our generational health, because it's going to, the more that we create spaces like this and continue to frequent them ourselves, the more of a norm it will become to host this dialogue and then empower and encourage our community to do the same thing in situations that are just between them and a healthcare professional. I think that it's a continuation of what's been going on as it involves health and wellness and just being Black in America. I mean, being Black globally, I think that being able to make informed decisions about what is done with your body, with your well-being, is not something that started yesterday and we're not going to get it right tomorrow. It has to continue to go in this direction. But we can't feel as though when we create these spaces and they're not maybe as well attended as we would like, that it's not what we want or not what we need. You know, I think that hosting these conversations, it's going to be difficult for everyone to get in the same space at the same time based on how our world functions. But when we're here to really take the time to have the dialogue and to break it down and not assume that we have to keep it at an elementary level and try to understand where the intelligence is with the individuals that we're conversing with, and not just, this is what I know, this is the only way I know how to explain it, but trying to make ourselves a little more open to learn something while we're trying to explain it and break it down in different ways.
And isn't that the true test, the true showmanship of intelligence, is being able to take high level topics and explain that and share that information to anyone. You're not the smartest person in the room if only you can understand yourself. So it just doesn't make it, that's not how it works.
I wanted to piggyback off of safe space and difficult conversations. I will hope that by now, 45 minutes in, we have demonstrated a safe space. And so I wanted to create an opportunity for questions and actually just get right into it about vaccination hesitancy, right? So why are people not being vaccinated? Maybe even talk about some of the concerns that some people have, some people who are on the call right now, or even concerns that we have heard in the office or with our friends and family, and let's just talk about it. And yeah, let's discuss and try to get on the same page about things, or try to, at the very least, have an understanding of one another. So I invite anybody from the chat to speak up or to write in the, or to write into the chat any concerns that you've had or that you heard of other people having. That way we can better understand, as healthcare professionals who are promoting the vaccine and encouraging people to get vaccinated, your concerns, and hopefully we can address them as well.
I'll say what I've seen the most across the board, mostly like young patients who are like, well, if I get it, it's not going to be truly detrimental. I'm young and healthy. I'll be able to fight this off if I do get COVID. Number two, I've seen like people thinking about like financial gain from the medical system. Like, well, if you guys get so many people who take this, there's gotta be some kind of kickback or something. And I've also heard patients say about other things as well. And like Student Doctor Shenika said as well, you know, patients, they're not saying they're not refusing, but they're like, just give me more time, which I think is totally reasonable. Like, I mean, anyway, it's an ongoing discussion, but those are some of the things that I personally have seen in my office. Oops.
Yeah, I think one of the questions that I hear come up is people still being able to transmit COVID-19 even with being vaccinated, although that statistically goes down if you are vaccinated, but there's still a chance. So being concerned with people who are vaccinated who aren't being asked to mask. I know that's less of a concern now because there has been more push to get everyone masked before you enter in public places, even though that's not always the case. That is something that I hear often.
I just wanted to combine something Tiandra said and something Dr. Blood said. So from what we know, a vaccinated person, the chances of a vaccinated person passing on COVID to someone else goes down because they're vaccinated. And so to Dr. Blood's point with young people saying, you know, why should I be vaccinated if I'm not concerned about my very own health? I think that as a community and society, that we should work together to protect one another the way we would want other people to protect our loved ones who may not be able to be vaccinated, or who just have compromised immune systems, you know, at baseline. And so to the people who feel like they are young and will kick the virus, yes, but also if you get the vaccination, you may not spread it to somebody who can't kick the virus.
I think another important point on that is that we're not discussing the side effects of contracting the virus. The ultimate is not always death. There's precipitating factors with contracting the virus that I don't know that is being shared with the community, and the impacts and how long those side effects can carry on and impact your pockets, impact your ability to work, impact
Quality of life.
Quality, like just walking up the stairs.
Or tasting food.
Right?
Or I mean, you never know what you have until you lose it.
Right, absolutely. But I think that is that age group that Dr. Blood was talking about, is those that still have that immortality complex, where it's like, no, I'm all right, I'm healthy, I'm this, I'm that. And again, their lived experience is that their cousin, their friend got it and it was okay. And I think a lot of times too, there are people in the media that are more political figures that are saying this, that, and the other, but they're vaccinated and they're just not sharing that information. Mm-hmm. The Texas governor, he is vaccinated and was very happy to get those monoclonal antibodies to treat his COVID, but he's not going to talk about that. And our previous president was also vaccinated, but didn't tell people about that. And it's just a very interesting dialogue that we're having. And it's such a shame that this is what we're choosing to politicize. Like, we are not doing mask mandates, but we're doing other mandates to other parts of people's bodies. So it's just very interesting that this is what we're choosing to focus on.
What other concerns have you guys heard from other people?
That the testing isn't as available and accessible as the vaccine. That's something. People saying that they contracted the COVID-19 previously, and so thinking that they already have a level of natural immunity. And so if I have that, then why would I then get vaccinated on top of that?
That's a very valid question, to which I would reply, there is some level of natural immunity to it, but it's also not 100%. And I have personally had patients who have come in with a repeat infection and have passed away and did not kick it the second time. There's also another strain going around. Viruses replicate and meaning reproduce and mutate, meaning change quicker than we do, obviously. So I would throw that out there. But just because you've had it once doesn't mean you can get it again. This is the bottom line. And getting the vaccine will help to build a stronger immune response if you were to get it again, in combination with the natural immune response that you have created by getting it the first time.
Right. And I think that the responses to those are that the vaccine's not 100%, right? Because that's a response that was given. And then also that, oh, I had it and it just slipped. So if you have it, it'll come back. I know that, I've heard the vaccine's not 100%. So when they hear that, and then also the different strands. So the vaccine was developed with a particular strand. And as you mentioned, it's constantly mutating. So at what point, like we're chasing. So both of those responses, they cancel out when you look at natural immunity versus vaccine, right? So people need more because logically that neither of those are better than the other when you talk about that.
Okay, yeah. Did you want to say something? Sorry.
Oh, it's okay. Go ahead.
I was just going to speak on the 100%. Absolutely nothing in this world is 100%.
Mm-hmm.
But what we care about in medicine and what we care about it with as people is trends, right? And so when we're looking at the people who are vaccinated versus the people who are not vaccinated, yes, you have some people who have been vaccinated who are still hospitalized. And yes, you have people who have been vaccinated who are hospitalized and die. But when you look at the ratio, the comparison to the people who are not vaccinated, there is a bigger number of people who are not vaccinated that are being hospitalized and are dying than those who are vaccinated.
And the role of vaccines isn't to not get it at all. And I think that has been a confusing thing, that people think that just because you had the vaccine that you will never get that virus. It is that your body can recognize that virus in a different, more sooner before it can wreak havoc on your body. And so the natural immunity versus the vaccine immunity is like, it's kind of like going by a recipe. You know that this amount of salt will make your food taste this way. But if you have somebody else make that recipe and they don't use those measurements, you're not sure what that end goal is going to be. So by getting the vaccination, we expect that you'll have a titer to it, and that will have a certain level of efficacy versus that natural result, because we're all different. So our body will recognize viruses differently. But with this vaccination, that virus we know that this baseline amount of immunity will recognize this virus. We're not saying that we're cutting off transmission. We're not saying we're preventing people from getting the virus. We're saying that we are attenuating the effects of that virus with this vaccine. And you can almost relate it to chickenpox, that the varicella vaccine, you can still get chickenpox after you get that vaccination. That happens. And so that's just kind of like, it doesn't keep you from getting it, but it keeps it from being worse. Having these poor outcomes.
Yes. I just like the analogy of it being a fire drill. So If there's a fire and you've practiced how to escape, when there's a real fire, you'll know exactly what to do. If you haven't practiced, sure, you might get lucky and make it out, but you also might not. And to just adding to it about it not being 100%, is our goal isn't to completely prevent it, but it's also to, like you said, to decrease the effects that COVID has on you so that you can survive it, whether you contract it or not. It's to help your body. It's just to add more soldiers to the fight, essentially. I can give two recent examples of two patients that I've literally had this week. I had one patient, the only comorbidity she had was that she was overweight. Came in, it's a woman, and then a man who has emphysema, which is a respiratory disease, who's on home oxygen. He was vaccinated, contracted COVID, came into the hospital. She was not vaccinated, no other comorbidities, both came into the hospital. She passed away and he survived. Whereas with his chances, I cannot say for certain, but I'm willing to bet that if he was not vaccinated, his lungs wouldn't have been able to handle all that. And he survived, and she didn't. And it could be due to chance, but I'm just saying, like, I strongly believe that that vaccine helped him to survive that COVID infection. So it's really just adding armor to the fight as we try to fight a virus, because we all know that with the virus, once you have it, you can't, it's your body against that virus. And there's no medication that'll kill it.
Another aspect to address too is, even if they don't think they can get the virus, what if they get in a car accident and need an ICU bed? What if there's something what if their grandmother has a failing kidney and she needs a bed? The hospitals are so strained in terms of staffing availability and beds because we are filled with COVID patients that are taking up so many resources. You don't have to get COVID to have a less than ideal hospital stay because indirectly because of COVID. You don't have the staffing. There's no beds available. Your level 1 trauma center, you're not going there because their beds are full. Now you're going to a step down unit. So it's not just COVID. Just like you can't get a couch now because of COVID.
I had to directly admit a patient and we didn't have any beds, and I had to tell this patient to go home and we'll call you when there's a bed available, because our hospital is overflowed with COVID patients. It's real. Like, the effects of COVID is real. Whether you feel like you'll survive it or not, it still affects the people around you.
So there's still some more COVID things coming out. I think it'll be available for children ages 5 and up next week. Excuse me. So that's another thing. There's also the mandates that are in hospitals and in other fields. Does anybody have any questions or comments regarding that? What do people feel about the mandates?
I was just something newer, right, is that there's boosters for all three, the Pfizer, Moderna, and Johnson & Johnson now. And what I understand is that you can have any kind of booster, regardless of which initial vaccine that you had prior, and that there is a suggestion to get the Moderna booster if you didn't initially have the Moderna shot, I want to say.
I don't know about that part, but I do know you can mix and match. I don't know about I can check though about the preference.
I can look into it as well.
But children, they have now approved the vaccine for children, yes, which is big, starting at ages 5. Yeah.
So I'm interested in what that looks like in schools, if they're going to start making this a part of the vaccine series that are required for children to be in school.
I don't think it's gonna be an easy fight. Do you guys have any comments about that? How do you guys feel about it being mandated? A part of me, the physician in me is like, yes, mandated, protect the public, protect those who can't be, vaccinated. But I also do believe that it should be a choice. To Tiandra's point of, a forced vaccine versus just us having the choice to be vaccinated.
I found the information that we were going to look into. So yeah. I didn't say it accurately the first time. It's if you received a Johnson & Johnson vaccine for your original dose, it says it may be best to get Pfizer or Moderna for your booster dose.
Because Johnson & Johnson's not an mRNA. Is that correct? Johnson & Johnson's a different kind of vaccine than it's not an mRNA vaccination.
Right.
Can you explain to us what that means for those who don't?
Why did you ask me that?
Okay. I can't in like the most layman's terms. What'd you say?
No, I've looked this up before.
No, yeah. It's essentially it takes a piece of the virus, like the part of the antigen to put it into our system so that our DNA can replicate, meaning like copy that RNA of that antigen, not the actual virus or I guess part that makes you infected, but to copy like a warning sign to let your body, so that your body can start this fire drill, right? So it's like recopying a fire warning sign into your body so that your body can get ready so it can stay ready so it doesn't have to get ready, essentially, if that makes sense.
Yeah.
I don't know if I explained that simple enough.
So, okay. All right. I've known this at one point in my life. Information comes in and gets pushed out the other side sometimes. But Johnson it's a delivery method. So Johnson & Johnson introduces the virus to the body in a different way than Moderna and Pfizer. So Moderna and Pfizer take a little piece of that. So it goes DNA, RNA, protein, right? And so what Moderna and Pfizer do, they take that middle building block and they introduce that into the body so that the body can recognize that mRNA and of the virus and attack it from there. Johnson & Johnson introduces the virus in a different way. They it's they introduce a little piece of the virus versus introducing a precursor to the viral protein coat. I'm sorry, I don't have a better. And this is why you should be able to break this information down so that masses can understand this. But it's the Johnson & Johnson introduces a little piece of the virus, and Moderna and Pfizer introduce a precursor to the protein of the coat of the virus.
So it's not the actual virus being introduced to the body.
No, it's not.
It's the makeup of the virus being introduced.
Mm-hmm. It's like saying, hey, that kid wears a red coat. And so every time you see the red coat, it's recognition. Just like anytime we see an M that looks like a yellow M, we think McDonald's. So our body sees this. What'd you say?
I said, no, we think McDowell's.
McDowell's.
I'm coming to me.
McDowell's. But yeah, so
what I understand, Johnson & Johnson is more traditional technology, whereas this mRNA is more recent technology, and that's what Moderna and Pfizer utilize. And so they're saying that if you did get, and we also know that the Johnson & Johnson vaccine was one shot, whereas Moderna and Pfizer were 2 shots, 2 doses. And for the boosters, they're saying if you did receive a Johnson & Johnson initially, that you should, I guess, introduce the mRNA technology through Moderna or Pfizer into your system. But I like the red coat analogy. I think that's helpful.
Thanks for cleaning it up. All right, so I'm gonna go ahead and wrap it up. Thanks everybody for taking out the time to join us in this crucial conversation. I hope if nothing else that you guys learned something that you can teach somebody else. And I hope that you appreciate the conversation and the transparency that we were able to share. Thanks to Student Dr. Zarebski for sharing her research. I think that was it was nice to learn. It's very important too, and I feel like we can just keep talking about it. And I'm interested to see like the follow-up data that you still have to sift through. And I'm also interested to see the reasons why. I don't know if that's another research project or if you had gotten to that in your research. Very interesting. But yeah, guys, for those who are on, definitely stay tuned. Keep following us so that you can join in on our talk next month. Thanks to Tiandra too as well for speaking on behalf of Tiandra herself as well as a patient advocate. That was really nice to have that the other side of the conversation as well. So we can end here, and then if you are a part of generational health, if you can stay on, that would be nice so that we can prepare